My name is Dr. Michael McCabe. I am a sports medicine surgeon here in Kansas City, and I have a subspecialty in hip arthroscopy. So hip arthroscopy is one of the newer specialties in the field of orthopedics, and it's probably really come about and grown substantially in the past 10 years or so. In that time, we've learned quite a few things that we have the ability to treat with hip arthroscopy. The most common situation is hip impingement. It's known as femoral acetabular impingement, so we call it hip impingement. Labral tears are commonly associated with hip impingement, and so the vast majority of what most hip arthroscopists will treat is hip impingement and labral tears. One of the most common diagnoses that I see in patients who are interested in a hip arthroscopy, because it's a less invasive surgery compared to some of the more complicated open hip surgeries, is arthritis. And we know very, very confidently that arthritis does not respond well to a hip arthroscopy because you're not treating or fixing the actual underlying issue. Probably the most important thing to think about in preparing for hip arthroscopy is the recovery afterwards. So you can achieve quite a bit during the surgery, but really the physical therapy and the dedication to the rehab program is at least as important as the surgery itself. If you're curious, if you are a candidate for hip arthroscopy, you should come in and have a set of x-rays, because oftentimes the diagnosis starts with an x-ray. And then we can have a conversation to see if you're a candidate. Feel free to reach out to our office and schedule an appointment. We'd be happy to see you.